So during the pandemic, I was lucky enough to work with a team of nurses in an IV reconstitution unit set up in a disused theatre. During this time, I really felt the one team attitude of the hospital, as we were all working in an unknown area. We like to call ourselves 21st century bomb girls. And it was a really exciting opportunity, and it was great to see pharmacy lead that.
Working through COVID-19 has indeed been quite a challenging time for all of us across the globe, including here in East Surrey Hospital. So whilst working in East Surrey Hospital amongst different teams and colleagues, I have experienced unity in diversity in providing care for these patients, witnessing relentless times of inspiration provided by the administration, seniors and allied healthcare professionals to care for these patients, while adding a little bit of fun to an otherwise hectic schedule, has inspired all of us to work as one team towards helping sustained patient well-being and health.
So during the COVID-19 sort of pandemic, I feel like as the pharmacy department we had to really become very adaptable to some very fast-paced changing environment. We had to sort of adapt in terms of infection control procedures, the way we work on the wards and ward moves, so we had to support the ward teams to make sure that medications were being administered safely, but in a new sort of novel way of working with infection control procedures. Not only that, we as a team were very resilient. I think when people were isolating or we were short-staffed during the initial periods of the pandemic, we still managed to sort of provide safe patient care.
The experience has been challenging, certainly from when it first happened in 2020. We very quickly had to adjust to what life was like in the procurement landscape. It was very difficult with our supply chains and what we could get in and what we couldn't get in. We have worked every weekend. We've been in 7 days a week, but we wanted to help our clinical frontline staff as much as we possibly could and in any way that we could.
And we didn't run out of any PPE. And that makes us, I think we both feel really proud that we managed to achieve that and that our team has managed to achieve that for the Trust.
During the COVID pandemic, the focus of our work has been on looking after patients whose COVID symptoms are so bad that they're struggling to breathe. We are able to use high-flow oxygen devices to support their breathing. However, we've also had to take a lot of patients to intensive care for further support and treatment. Seeing the fear in someone's eyes that is struggling to breathe due to coronavirus and then telling them that you're going to have to take them to ICU is something I will never ever forget. On a positive note, seeing patients who have been really unwell but have survived COVID and ICU and are now ready to rehabilitate and to go home to their families is the most satisfying feeling ever and makes everything worthwhile.
Last year, working during the pandemic situation, I think what happened is we were all in the same boat. We were not sure what was going on. But what was really nice and interesting is working as one team. We all help each other. When I say help, I'm not saying not just the patient, but even colleagues and anyone that can work together to be able to deliver the service, go the extra miles to help and support each other. And it was an absolute privilege, but it's still now an absolute privilege to be able to fight for others.
During the whole time of pandemic period, we had a restaurant open. We never stopped our services. We knew it. Our services is very important for medical, non-medical staff.
During the pandemic, we have realized how important it is to be together and to talk to each other. We spoke with everybody, with doctors, with nurses. We always make sure that we ask how they are and we share a laugh. We always make sure that we welcome everybody with a smile and open arms to make sure that everybody's feeling good in our restaurant.
We didn't only become a family for our team or our colleague. We also, I have seen example of nurses become family to the patient who are dying. Because at the time, people were dying without their own and the loved one. and we were the one who were holding their hands.
Yeah. That was difficult for staff as well, but a lot of them on reflection have actually felt really honoured that they were with them at the time. So, overwhelming is certainly a word, but actually looking back and reflecting on it, there's a lot of pride with that now. And how the ward handled it, how all of our colleagues handled it.
Hi, my name is Raim. I am from Brazil. I am a ward hostess for Live Ward. Well, at the very beginning of the pandemic, it felt surreal what's going on, and it was a very difficult time to deal with. I was very worried and I felt scared to go inside the ward, but you build up the courage with time. But speaking to my ward colleagues definitely helped a lot. We felt united and we knew together we could beat COVID. It was very nice to see I belong not just to a team, but to a family.
We launched a safe and rapid quality COVID testing service from scratch, which operates 24/7.
One of the biggest challenges we faced was due to the national reagent allocation, trying to fit 30 tests a day in for a 600-bed hospital.
It's been a year like no other. I plan for emergencies in my day job, but no one could plan for COVID. There are no words to describe the roller coaster that was 2020.
Last year was definitely an experience, to say the least. And I remember when myself and Amisha, who's my pharmacist, we were on Tilgate. We were rotated to be on Tilgate during the COVID outbreak, and I remember the day actually, we had our first COVID patient admitted, and just the feeling on the ward, like the atmosphere was just insane. Like we were all terrified of it, and it was just the thing that I found quite comforting was that everyone was in the same boat with it.
So I work for the hospital charity, and we decided very early on to focus on supporting staff welfare and urgent requests from members of staff. We were able to, thanks to some extraordinary support from our local community, we were able to fund things like tablet computers for every ward at SASH, so that family members of people with or without coronavirus could do video calls with them right the way through when visiting was restricted, all the way through to really meaningful things like supporting psychological interventions with staff and workshops for people who have been going through this very difficult and at times traumatic period.
I mean, personally for me, it only dawned on me that it was going to be, how bad it was going to get when I remember stepping onto HDU, which is normally our level 2 patients, and then suddenly it was full of ventilated patients. And then every time we sort of went into the next area,
created a new ICU on another medical ward.
It was kind of those sort of times which, when I think back, really stick out in my head. I can still remember walking into HDU and being, although we knew it was coming, still being quite shocked.
So at the start of the pandemic, Chris and I thought about what we could do to make sure that the patients that we would normally be involved in, we didn't miss. And so we started doing daily ward rounds, where we would go to every ward, every day, and check in with the nurse in charge and the staff there. Do you have any patients that have a learning disability? Any patients with dementia? Any safeguarding concerns?
And so I make a point of checking where the patients with dementia are, phoning into families and just checking with them and giving them some updates on how their loved ones are, and sort of giving them that sense of assurance that we are aware of their dementia, aware of their other needs that they may have, and just kind of continuing that support that we would have provided if they were on site.
My first day here at SASH was the first day of our response to this pandemic. To say my experience has been a whirlwind could be an understatement. I was inspired mostly by the energy of all staff here when we needed to react. Without hesitation, all staff rose to the challenge.
Since patients could had to stay at home during lockdowns, we had to innovate. And whilst in the past we would have thought it was impossible to treat patients from home, we were now forced to think about how we could help these patients from home. And I discovered that actually seeing patients by video and being trained to do video clinics by senior clinicians we can actually pick up a lot of information. So, and what I've basically discovered since COVID is that there are lots of things that can be regarded as positive. We've tried to step back, think about conventional ways of working, think about how we could make it better, and in fact we found so many better ways of working that they are here to stay.
I think for me, one of the things I've realised is how much I value being at work, and I feel very lucky and blessed to have been at work throughout this period. But I just realised I need the social interaction, I've needed that challenge, and just to be able to intellectually use my abilities, to feel like I'm contributing in a small way.
So working through the COVID pandemic for haematology was very much keeping our immunosuppressed patients safe, carrying on with as much treatment as we could, relieving their anxieties.
Our pandemic was slightly different, and what I wanted to say is a huge thank you to the chemotherapy team. For us, our goal was to keep our patients safe, and so we moved to a cold site very early on in the pandemic. So the first weekend in April, the chemo suite moved, and then in May, Comet moved. We were there for a year. The team were phenomenal, and I was humbled by the experience and watching them work together hands on.
Being able to offer them their listening ear, offering the prayers for the ED and ITU nurses before they start their shifts, 7 o'clock in the morning and 7 o'clock at night. And I could see staff who were finishing their shift and they could just burst in tears. And I was there with them and journeying with them. Or sometimes when the staff go for the break, you could see they're just exhausted or they are so upset for feeling hopeless. And I've seen that most of the staff and journeyed with them. And one of the key things that my department did is to offer the staff support. So we were so keen to offer that staff support, and we are continuing now. We are still offering meditation now, and we have started offering bereavement support. Going through that, I've seen more deaths as more than I have ever seen in my 15 years as hospital chaplain.
And I think our role, therapists, not just in ICU but across the hospital, that we can often spend a lot of time with patients, like sitting with them, talking to them, which doctors and nurses don't always have that time available. And then to have visitors not be allowed in, which was so hard for the patients, that actually we were taking on a huge role with just comforting patients and trying to facilitate them being able to talk to families.
So on ICU we quadrupled our capacity from 4 full-time physios to 16 full-time physios working 12 hours a day, 7 days a week, and most of that was to support sort of nursing staff, to help with proning. We were sort of helping with washes, we were sort of taking the less clinical bits of the nurses that we could do just to help support them, as well as chest clearance and our rehab that we would have normally done. We obviously work closely with ICU nurses. I guess my admiration for what the ICU nurses went through and seeing them,
so much pressure was put
on them, and
teams,
and they were just phenomenal. I don't know how they did it.
Dived headfirst into helping both non-clinical and clinical teams around the challenges that they face with COVID, and especially around processes. One particular area that I focused on was patient property. So what we did is we actually managed to employ an extra porter who was just dedicated, you could say like a postman for example, who was just solely there to deliver patient property. So something that would take a really long time to deliver actually managed to be 10-15 minutes maximum, which is amazing for our patients.
Support from the trust was absolutely marvelous, right from the cleaners who has constantly keep us on the clean side, and also from the support from psychologists and like Chisholm.
And our duty of care became so frontline for everything, and everybody was honestly, I cannot say, everybody was just amazing.
Exhaustion. Shocking.
Challenging.
Heartbreaking.
Emotional.
Surreal.
Humble. Draining.
Commendable.
Family.
Brave.
Inspiring.
One team.
One word describing my colleagues, they're phenomenal.